Good morning, everybody. I'm happy to be here today. Okay. Well, today I'm going to be talking about fall prevention, strategies for fall prevention. And like Dr. Hinshaw says, yes, we know each other from physical therapy. Um, but my background in fall prevention goes back at least 10 years. I'm a member of the State of Hawaii Fall Prevention Consortium and a chairperson for about 6 years. And I also give a clinic on fall prevention at Straub. So I hope I come with some information for you that may be eye opening or at least gets you to take some action. Yeah. So, my first question is, how many of you have experienced a fall in the last 12 months? By show of hands, please. Good. Skiing? No. But now, how many have had family or friends experience a fall in the last 12 months? So, quite a bit. Um, you know, Nationally, locally, there's been an increase in awareness about falls and the devastation that the injuries can have on us, especially among the elderly. So, awareness right now is something that's, I think we're all, onto. But what we want to do is spur people into action for fall prevention. And our community has been lucky because we've been having a lot of public service announcements. The media has been covering it. Just recently, I don't know if many people saw Ron Mizutani had a collaboration with Kaiser and the consortium. He had a half-hour television show on fall prevention. And this was spurred because of a family member that had a devastating fall. So the local facts are kind of interesting, and I call them factoids. And this is specifically for Hawaii. This data comes from the Department of Health, the years 2005 to 2009 from the Injury Prevention and Control Program. And you'll see that falls among the elderly, and in Hawaii specifically, leading cause of fatal injuries among seniors. It's the leading cause of injury-related hospitalizations. It's the fifth leading cause of injury-related emergency room visits, and the third leading cause of injury EMS calls, the ambulance. This is significant because we know that in the next few years, our elderly population will grow significantly. And so, unless something is done significantly, these numbers will continue to grow. So I look back and there are falls that I've had, I remember, but there are also celebrity falls across the gamut of age. We know that Hillary Clinton, she's been in the news a lot lately. She had a fall and suffered a concussion. And so even to this day, people are questioning the effects of that concussion on her, right? Some people. Beyonce, we know she's a young lady, woman, beautiful entertainer, singer. She had a spectacular fall downstairs as she was entertaining, but she had stilettos on as well, like Tina. And I still remember Fidel Castro's fall, and that was in 2004. I see the video over and over, and we haven't really heard too much from him after that fall. And there have been other high-level celebrities that have experienced falls and actually passed away as a result of that fall. So we know that that is always the end result sometimes of a fall. So right off the bat, before I get to the strategies, I want to say falls are not 100% preventable. Okay? We are all at risk for falls. Some of us have greater risks than others. Some risks we cannot change. But what we're going to be looking at are the risks that we have individually that we can change. They are amenable to change. And that's where we get the strategies from. So, do you think that age and gender makes you at risk for a fall? Yes? Any no's? Okay. Of course, the answer is yes. Okay. So these two risks, age and gender, are really not able to change, but they do put us at risk. The number and rates of falls increases as we age. I think we probably would all agree with that. But we see that the rates for 85-year-olds are 5 to 11 times higher than 65 to 69-year-olds. And when we look at gender, for fall risk, women experience greater amount of falls at every age group. However, when men experience a fall, there are more men that actually die from their falls than women. And I think that's because of the verticality factor. Guys are more than likely to get on stools, chairs, counters, step ladders, roofs. And so when they do their falls or when they experience their falls, it's from a greater distance. And so men have greater risk. So these two things we can't change unless, well, these days, some of us have been able to change those risks. Somebody like Bruce Jenner, we have a lot more people changing their genders. But what happened when he changed his gender? He increased his risk, you know. So there are other risks for falls, and I'm going to kind of go through them. And think about, as I go through these risks, think about how many of them you experience yourself, okay? So medications, the amount and type of medications that we take can put us at risk for falls. Gait and mobility, if we've gotten a little bit shuffling in our gait as we age, or if we need a walker or a cane, definitely that puts us at risk for falls when we need assistance. Our muscle strength. Many times as we age, our muscle strength decreases because we're not as active or something happens to us, we have a medical issue that can put us at risk for falls. Postural hypotension, when we go from lying down to sitting to standing and we feel that faintness or lightness in our head, that can give us at risk for falls. Okay, and sometimes our medications can do that, give us that postural hypotension. Definitely environmental hazards, things like slipping in water, stairs, darkened area where we don't see something, we trip, or just clutter in our homes. I think clutter in our homes is a big deal. Those can put you at risk. Then we go to things like vision. Usually as we age, our vision changes, and we may even experience some medical issues that limit our vision as well as limit the field of vision. Like a stroke can limit our field of vision at times or give us problems with depth perception. Balance definitely is something to consider. Half of my patients, when I get them to do certain exercises, they're like, I've never had balance, even when I was in my 20s. But balance can be learned and balance can be lost. Heart rate and rhythm, definitely if we have some heart issues, we're not getting blood to our bodies, sometimes we can be more faint and that increases our risk. Footwear. If we have footwear that doesn't fit right, or they're not in good repair, or like Tina, stilettos, or Lady Gaga, she wears those high sandals, those things can put us at risk, what we wear on our feet. And then the neurological impairments, what is that? That's things like Parkinson's, where you see the shuffling of gait, decreased mobility, a stroke, when you have some weakness or paralysis, those things put you at risk. So there's many of those out there, and I hope that you were, as I was listing these things, that you were thinking about, where do I come in with some of these risks? Now, the biggest risk factor of all, I already asked you about. And this is number one across the board in all the research. And that's if you've experienced a fall, one or more falls in the last 12 months, you are at high risk for another fall. And so in this case, prevention is better than intervention after the fact. So the longer we can keep you from having a fall, the lower your risk goes. Now, why is it important to know these risks? I'm talking risk. Well, from these risks, that's how we're able to get strategies to reduce your falls. These targeted strategies are more likely to be effective for you. So for me, I look at all of these risks. I don't take medication. I do have some muscle strength problems because I'm still recovering from my third total knee replacement. And my footwear, I try to be careful about my footwear, and I'll tell you why later. I don't have any neurological impairments, and my balance is still not 100% right now because of the recovery that I'm undergoing. So for me, my targeted strategies would be different from, say, and if we target it that way, then we choose those strategies that are targeted to our risk and use them in daily life, we can reduce our risk. So the 4 strategies that I've chosen, and actually not me, the Center for Disease Control chose them, the government. They looked at all the studies that are out there and the research that's been done, and they chose 4 strategies. These are generic, that can give you the best bang for your buck for prevention. And that's what I'm going to start with today. And number 1 is have all your medications reviewed by a doctor or pharmacist yearly. Number 2, have your vision checked by an eye doctor once a year. Number 3, make your home safe from physical hazards. And number 4, participate in a regular exercise program. And I dare say these might not be revelational, but we'll talk and elaborate on them so that you can understand maybe the importance of them. So when we look at medications, the risk factor begins when we take 4 or more medications. Doesn't matter what they are, they put you at risk for falls. As you age, the medicines that we take respond a little differently in us, as compared to when we were 40 versus 60. And they definitely, medications will respond a little differently in a 20-year-old versus an 80-year-old. And so we have to be aware of some of those changes. They stay in the body longer sometimes. We're not excreting it. The interactions change. And so having them checked will be important. Caution should also be taken when using medications that make you sleepy or dizzy. I worked with on the Straub Falls Committee for inpatients, and a real concern there was when doctors prescribe sleeping medications. That puts our patients who are already medically fragile in an even bigger risk because of some of the Ambien or things that they take. So if you have some of those medications that you're taking, be cautious, okay? So the solution is have all your medications together, take them to your physician or a pharmacist. The pharmacist will do this too at least once a year. Include your prescribed medications, your over-the-counter medications, as well as your nutraceuticals and vitamins. Have them check it. A lot of patients, I know in my experience, they go to 4 or 5 different doctors, and not all of these doctors are on the same computer system to know everything that's being prescribed. And so going to one central doctor that will help you with that can be important. So now, vision check. Why is this important? When we look at our balance system, there's 3 systems in our body that help us with balance or are responsible for our balance. Vision is one. The second is our vestibular system, or the middle ear. And the third are these receptors or proprioceptors in our joints. So if we take care of our vision, at least we got 1/3 of those guys going. And as we age, it is recorded that our vision changes. It usually doesn't get better, it usually gets worse. Things such as cataracts, glaucoma, strokes can alter or limit our vision. Eyeglasses, they need to be updated. I know they're expensive and sometimes we kind of keep them for longer, but go ahead and see your eye doctor and see if your prescription needs to be changed, because that's going to be important. If your vision isn't good, your depth perception, any of that stuff, that can lead to falls. So, solution, have your eyes checked yearly by an eye doctor. So we come to home safety. Half of the falls occur at your home. And so making your home safe is going to be kind of a great impact, a huge impact on you. And we're looking at Straub again at that inpatient. This is just hospital. Most of the falls occur from the hospital bed to the bathroom. And if any of you know Straub, that distance isn't very great. It's because they have private rooms, so it's very short, but you have medically frail patients as well as maybe medications. And so, same as in the hospital, your route from your bedroom to your bathroom is really important. That the lighting be well, that the area be clutter-free, because that's when you're going to be getting up, maybe not quite oriented, trying to rush sometimes to get to the bathroom. And so that's where your greatest risk will occur. So make sure the clutter from the bedroom to the bathroom is free. Improve your lighting in your home. I know sometimes with these new light bulbs and stuff, I feel like my lighting in my home isn't bright enough. Then make sure that your lighting, especially around stairs and pathways, is good. And that goes to the vision, yeah, again. Avoid small, like throw rugs, as they can be a source of tripping and falling. And I would add here small animals too, okay? Or big animals, as in my case. I experienced a near fall because of this factor. It was in my office, and the dog gate was open. I thought it was closed, and so I was finished. And since it's not very far from my office to my bedroom, I shut the lights off. So I'm walking in my hallway, which is clear, except in this case, my dog was in the hallway. It's dark. I don't expect him there. I don't see him. I trip over him. He's a golden, so he's big. And so the only thing that kept me from falling, I say near fall because I didn't hit the ground, was this finger got stuck in a door jamb. And that's the only thing that kept me up. And so, of course, it dislocated, it fractured, and I use my hands every day. So I immediately put it on ice, I immediately splinted it. I did everything I could. But to this day, I can't wear a ring because my knuckle, it fractured at the joint, so I can't fit my ring over it. So that's not a devastating fall, but, that's having an animal underfoot that you're not expecting. So even something like that can, occur. So when you look at your bathroom and your kitchen, keep the things that you use often within hand or arm reach. When you start to get up on stools to reach things in your kitchen, you put yourself at risk. So your everyday dishes and pots and pans, keep them close to you, okay? Just plan it that way in your cabinets and stuff. Also, most people know that, okay, if I make my home safer, handrails, grab bars in the bathroom, the showers, those are pretty automatic things we think about. But another thing is what you wear in your feet. whether you're going barefoot or slippers or socks in a home with maybe laminated flooring or tile can be slippery. I had my niece, she wasn't used to laminated flooring. She had her socks, boom, down in our house, young. But also, I've had a fall, and this was a fall. I had some rubber slippers that were worn down, so the soles were slippery, and going down the stairs. And if I had had regular rubber slippers that had some grip on them, I wouldn't have slipped down the stairs. And again, I was recovering from my second total knee, and I couldn't really have the strength to recover. So that was a fall. And, of course, I blamed that on the rubber slippers, So those slippers got flung across the yard, So your shoe wear can be important, okay? So the solution is methodically go ahead, check your home, make it safer, get rid of the clutter, or have a home assessment done. We have specialists out there. Occupational therapists can come to your home and look at it and give you ideas as to how to make it safer. This is kind of usually by a prescription with a physician, but there's this wonderful community group. It's a nonprofit. It's called Project Donna. And they will come out, you make an appointment, they will come out to your house and assess the house, give you ideas on how to make it safer for falls. And also, from time to time, they have little grants where they actually have money so that they can maybe apply some of the handrails and for you. This is not always the case, but what is actually always free will be the home assessment, and they do a really great job. And that's Project Donna. Project Donna, but it's DANA. I believe it's through the Buddhist church, but they don't, try to get you to join the Buddhist church, but it's just a community service. They do a good job. So the next thing is the fourth strategy was to do a regular exercise activity or be active. So here we're talking about all forms of exercise. And I want to just tell a little story that had great meaning to me. If you've heard it before, sorry. But I usually see patients every day. And when I see them for the first time, I take a history and I talk to them about what their problems are. But because we're on a computer system, the very first thing I usually have to ask them after introducing myself is their birth date to make sure that I'm on the right computer, I'm inputting into the right chart. So I introduced myself and I met this man and I asked him his birthday. And he says, I'm 89 years old and I can put my pants on standing up. So of course, I had some eye rolling that I had to hide, but inside of me, I was like, well, okay. And I was kind of like, okay, you didn't answer my question, too much information. But I had a check in my spirit, and I just didn't say anything. And I thought about it. And this guy was telling me a lot of information. Okay. In that one statement, he told me that he understood that his health and wellness related to his function. He was telling me that he had sufficient leg strength to stand up, put on his pants. He was telling me that had sufficient flexibility so he could lift his leg up to get it into his pants. He had great balance because he was standing on one leg to do that. And most of all, he had the confidence to do it. It's all in one little statement. The thing was, I guess why I remember it the most is because I was just back to work after, recovering from one of my total knees. And I wasn't standing up when I was putting my pants on. and I'm not 89 years old. And so that really made me feel bad because I've been returned to work, but when I return to work, I'm still having problems. I'm tired. I'm in pain when I go home, and so the exercise starts getting less and less for me in my recovery instead of keeping up with the exercise. And so that spurred me into action, thinking, yes, I'm not doing that. I'm not fully recovered. I need to get back to my exercise, even though I'm tired. And so that's a little story that made a big impact on me. So, doing regular physical activity is one of the most important ways to reduce your risk for falls. Why? Exercise can prevent the weakness, which leads to increased risk. Exercises can be targeted to improve your flexibility, strength, balance, or coordination. Sometimes we're not deficient in all of these. Sometimes it's just our balance and we got good strength. So you can target that. Now, when we talk about group exercise, the CDC, Centers for Disease Control, the government, with all the research has come up and said Tai Chi is the best group exercise or as individual for fall prevention. And we're lucky enough that after I speak, Elena will be here, and she's a Tai Chi master. And because of her efforts and the Falls Consortium, we've been collaborating with her. She has been training a lot more Tai Chi instructors. And so we're starting to have more and more of these classes available on Oahu and on the neighbor islands. And so this is, if you're able to do a group type of exercise, that's a good way to go for fall prevention. Now, when we say that that's the best, that doesn't mean that's the only thing that you can do. There are other programs out there. Honolulu Gerontological Society has some prevention, fall prevention classes, HMSA, HPH, Queen, so they're out there. But the best exercise is the one that you will do, and you will actually consistently do it. So if you go to Tai Chi every 2 weeks, even if it's evidence-based that it's fall prevention, I would say that's not enough, okay? So you want to choose something that you will do and will enjoy and participate in consistently. And so I call that opportunistic exercise. And what are these exercises? They're things you can do throughout your day as you go about your day. You don't have to use any fancy equipment, and you can use them to improve your flexibility, your strength, and your balance. And we're going to do 3 of those that I chose today, and Dr. Hinshaw is going to help me. And I chose them for different reasons. And so if you guys will get up off your feet so we can be a little more active. So the first one is the sit to stand. And pretty much it's for leg strength. We use that as a measure of leg strength across the board. There's norms for different age groups. And the idea is, can you get up from your chair without using your hands? The thing is, when you do it, make sure the chair is sturdy and most times against something. So what I would say, maybe have somebody maybe hold the chair for you, as you're going down, because you don't want that chair to slip out away from you, okay? And then we have a fall. But the idea is you're going to be using your legs. And she knows how to do it, okay? So as she goes down, the butt will be going down first. The knees never pass the toes. So you're going to be transferring your weight forward. You're going to be hinging at the hip to do this, okay? Try it. Cool. Looks like you guys can do it. It's like these chairs must be high. I have a chair at the clinic that they have really hard time getting out from. Okay, you guys do great. So the test that we actually do would be starting with your back against the chair, and you would be standing up, fully standing and down 5 times, and we would time that. And so, of course, fast is better, but I always tell my patients safe is better too, you know. And so that's how we would get the norms. I think at the end of my handout, the norms are in there. Okay. So now that's for leg strengthening. We're going to do the next one is going to be for the calf flexibility. So this is a flexibility exercise. It's a calf stretch, and I think you probably have all seen this. We call it the runner's stretch. Why I chose it is because the research show that increasing your ankle and calf flexibility can reduce your falls. And a lot of people, as we get older, our Achilles are very tight. And that reduces our ability to kind of right ourselves as we kind of lose our balance. And so it's a good one. It's in standing, so you guys can stand on up. So come on over here. And so what you're going to always do is use something like a wall, a counter, a chair, telephone pole. Well, you see the runners doing it at intersections, against the poles. Okay, something that you can use for balance. Okay, and so the back leg. So bring the back leg back is the one that's going to be stretched. You want to make sure the foot is turned in or straight. Most of us, we line it up, turned out. That's a very popular way to compensate because we're tight. Turn it in. That's how you're going to get the good stretch. The heel is flat, the knee is straight, the front leg is bent, and you're just going to be shifting your weight forward until you feel a gentle stretch. And when it is a flexibility exercise or a stretching, we hold for at least 30 seconds. Okay? And if you go upright like so and go forward, then we even get a hip flexor stretch too, which most of us need because we sit a lot. Okay? So we can get more bang for a buck on this baby. Okay, so that's the flexibility, the second one. Any questions on that one?
The hardest part is keeping your feet straight.
Straight, yeah. So the third one I chose was a one-leg balance, and it's because it's a balance exercise. But in addition to being a balance exercise, it's a leg strengthening exercise, okay? If you don't have leg strength, you're not going to be able to do it. So it's a duo type of thing. There are age norms to it as well, from 20 to 90. But I say if you can do one leg standing balance, 5 seconds, for 30 seconds, you're good. You're good for a 20-year-old. So if you can shoot for 30 seconds, you don't even have to know the norms, okay? And the idea is have something that you can use for balance, not without anything. So that you can actually shift your body weight over to that foot, feel the foot and where that weight is first before you let go, and then do your balance. Now, I have, I would say, do it at a time when you're concentrating too, not when you're, distracted. So I have patients and they're, doing all of this and going all over the place just to keep their balance. Don't do that. If you're losing your balance, just put your foot down, okay? Because, again, I don't want it to be a risk. Yeah. What is that? The eyes, okay? So if this is like too easy, what do? Close your eyes. And then that's really hard, okay? So Yeah, she says focus, right? And so I said, don't be distracted, folks, but that vision is important. And that's how we make the exercise more difficult when it's too easy is close your eyes. But right now, you're just going to start with, can you do the 30 seconds? And one side may be different from the other. Okay? All right. So thank you. I'll continue, but those are the 3 that I chose for now. Hopefully that woke you up a little bit, gave you some good information. And so the specifics are in your handout. So we come to, now we talked about community exercise or physical activity. We talked about opportunistic exercise. We're going to talk about physical therapy now. And of course, that's my baby, so that's my bag. Physical therapy is into place when you have somebody that is not able to participate. They're not at a level that they can do Tai Chi. They have a physical issue that maybe needs to be addressed first before an exercise program can be started. Or maybe they don't really have any idea how to start or what they should be targeting for their fall risk. And of course, the one that we see the people mostly would be if they're unsafe already with their ability to move about. The solution is get a referral from a physician. When we evaluate you, we're going to look at strength, flexibility, balance, function, and then design the program for you at that point. So we talked about the 4 strategies. Number 1 was medication, get them checked. Your eyes, get them checked. Your home, make it safe. And physical activity, get some regular physical activity in. There's 2 areas that I want to bring up at this time, and they have nothing to do with fall prevention. They have everything to do with when you've fallen. So I think we've seen ads for those things you put around your neck so you can alert someone once you've fallen. I think that's very important because the statistics show that if you've fallen and you can't get up and you stay there for hours or even a day or 2, that increases your mortality rate. So you need to get help right away if you can't get up. And so it's advantageous if you have family members or, you're one of those fallers and you're not sure, get one of those alert alarms or always keep your cell phone with you and have it programmed so that you can call your neighbors or family members that are close or the emergency. Okay, so that's once you're falling, you don't want to be laying there for too long. And so this group looks pretty healthy and fit. And so what I would say is, second thing that you want to look at is make sure that you can get on the ground and get up on your own and practice that. I have many people, they're active. They walk in and they're just coming in for a shoulder problem and whatnot, but they don't go on the ground because it's too hard to get up. You need to be practicing now. In case that occurs, that you have a fall, that you know what to do, you have the confidence. And if you're on the ground, what I say is calm yourself first because your adrenaline is going to be pumping, okay? Calm yourself. And then take an inventory of, if you're hurt or if there's any areas that, you've experienced a problem, and then call for help or try to get a strategy. How am I going to get up? Can I get up because I don't hurt, I'm just embarrassed? Or do I need help? Do I need to maybe roll to something so I can use a chair to get up, or do I have to crawl? But start to think about that. And the best thing right now is just practice getting on and off the ground. So the last thing, homework. Dr. Hinshaw asked me to give you homework. So the homework would be trying those opportunistic exercises. One particularly would be that 5 chair repetition sit to stand. So throughout the next coming week, try to do 5 to 10 sit to stands without using your hands each day. The idea is do it with a sturdy chair. You can do it going into and out of the car, on and off the toilet if you feel confident enough. But practice that and work on that. That'll increase your leg strength and some of your balance as well. At the end of the week, test yourself on the 5 chair repetition sit to stand. The norms are right there. 60 to 69, that 12 seconds, that's for women, and 11.4 seconds, that's for men. So that's what you're shooting for. If you do it below 12 seconds, you're normal. That's a good strength, that's a good test. So that's the end for me. Thank you very much. Are there any questions?